Welcome to the Fit Media Network, the channel dedicated to healthy living and fitness. We speak with coaches, doctors, athletes, and more about their routines to help you feel, look, and perform at your best. Is there anything else that you think is important for people to know or that you'd want to add?
So you touched on atrial fibrillation, and I think in the sports cardiology world that deserves specific mention. And atrial fibrillation, for those who may not know, is an abnormal heart rhythm originating from the top chambers of the heart, or the receiving chambers, the left and right atria. And the reason that's important is because when we think of atrial fibrillation in athletes, we know that for people who are sedentary, people who don't exercise, there's an increased risk of atrial fibrillation. With moderate intensity, low to moderate intensity activity, there's actually a decreased risk of atrial fibrillation. With men specifically, the more vigorous exercise you do, specifically endurance, there's actually an increased risk of atrial fibrillation. So if you think of it as a J, where on one end you have sedentary people, an increased risk. On the bottom end of the J, people who are moderate intensity activity, protected from the atrial fibrillation. And then on the other side, males who do endurance exercise, increased risk of atrial fibrillation. So that may make a lot of sense for you. Women actually are protected all the way through. So the more exercise you do as a woman, you are probably protected from atrial fibrillation the further you do. So that's an interesting nuance. And for folks who are vigorously exercising active endurance, this is something to be aware of. So the palpitations that you have, you may want to take them seriously. We would never discourage someone from exercising to prevent atrial fibrillation, because again, all these things I've said before, exercise is healthy, it's the best thing you can do for yourself. But being aware that with vigorous endurance exercise, someone who's doing this at a very high level, this may be something that you have to deal with.
Sometimes, I know when I had the Afib, I felt the palpitations and some chest pains, and just kind of felt like, hey, that's what happens when you're training. You have the chest pains. Is Afib dangerous?
In and of itself, atrial fibrillation is not dangerous. The heart rhythm cannot kill you, it cannot harm you. It can be pretty burdensome, as you can attest to everybody out there. It can make you feel unwell, it can make your performance decrease significantly, but the rhythm itself is not dangerous. Where atrial fibrillation comes into play is the risk of strokes. So atrial fibrillation is the leading cause of strokes in this country. And what happens is blood pools inside of the heart, and a piece of blood can, when it does pool, a clot can form. And a piece of that clot can break off and travel to the brain. And these are all the commercials you see on television, like Xarelto and Eliquis, and previously Coumadin as well. We use different calculations and risk factors to incorporate who should be on blood thinners and who shouldn't. But the rhythm itself, in a vacuum, no, it can't hurt you. For athletes, it's going to make your performance not be great, because the heart is going to be functioning inefficiently. Some people who have atrial fibrillation never get back to the performance that they had, and we don't completely understand that mechanism.
Okay. Now I hear other arrhythmias and people talking about other arrhythmias like VTach and things like that. Are they going to have different symptoms than an Afib? And what symptoms are really symptoms to be concerned about?
Yeah.
And what do you do when that happens?
Yeah, two very important but different discussions. VTach, ventricular tachycardia, and VFib, ventricular fibrillation, certainly have made headlines. Very different than atrial fibrillation. So these are very dangerous heart rhythms that are usually a sign of underlying heart pathology. So being some type of defect in your heart that would be very concerning. That warrants immediate medical attention and consultation with myself, an cardiologist, an electrophysiologist, and figuring out why that's happening and how we're going to treat that. And the guidelines would suggest that if you have that, your participation in sports or any type of physical activity should be limited until that's figured out why. Signs and symptoms of that, so chest pain obviously would be a concern there. Really the biggest one would be passing out. So if you pass out during exercise, if someone is running or they're biking and all of a sudden, boom, they're out, very, very concerning, should be taken seriously on every level and worked up thoroughly. Other things, palpitations, racing heartbeats, as you've talked about, declining performance, abnormal shortness of breath, so shortness of breath that is out of proportion to the exercise that you're doing. These are all complaints that we see often and would warrant further considerations. Now, not necessarily going to be a heart rhythm issue, but if we discover these heart rhythm issues, we really have to work our way through.
You do something about it if you discover it.
Yeah, oh, absolutely. Yeah.
If you don't discover it, you can't do anything about it.
That's correct.